more senses there.
Yeah, start.
Take. Just a short prayer. Nama Nama, everybody. Body is straight. Close your eyes and align your body, mind, and breath. Patanjali invocation. Yogena Chittasya Adena Vacham Malam Sharirasya Cha Vaidokena Yapakarattam Prabharam Maninam Patanjalim Pranjali Ranatos Abahu Purushokaram Shankachakra Shidharanam Shastra Shira Shangshitam Pranamami Patanjali Om Ananto Nagarajaya Nami Namaha. Ravi. Today my topics is on disease. So I invocate Patanjali Yoga Sutra. Invocation because a great Rishi gives us three aspects as physical health, at chitta and mental level, and speech and social. So salute that great person. My topic is yogic management of diabetic disease. And nicely told Swami Vivekananda, when every cell in the body sings the songs of the soul, when every cell in the body sings the song of the soul, it is called yoga. It is very important in these topics because when our yoga is soul therapy, so when our soul is purified, it already automatically all therapy is done. So yoga is potentially therapeutic. Today is 11th July 2024. I am a student, Bikash level 7, 27 therapeutic yogic class, Thane School of Yoga. Why I choose the topics? Nowadays, yoga is very common. It is the burden of the globally, it is burden of globally and also in India. Before 1950, the common cause of death is due to communicable disease like diarrhea, cholera, plague, malaria, etc., yellow fever. But after 1950, non-communicable disease becomes prevalence, more killer of the person. In a study in 2021, globally it is shown that about 6.1% of the population, adult population, are in diabetes. Whereas below 20 years is only less than 1%. In India, it is gradually increases. A study published in the Lancet recently found that on 1 million, that is 10 crore, about 10 crore of the people are more than 10 crore in population is in living in diabetes, adult. A survey also found that on 36 million people, about 15.3% of the people could be living with pre-diabetic condition, undiagnosed diabetes. So in this graph, on the right side graph, you easily visualize the situations in India. 20 থেকে 79 years age, In 2019, it was 7.77 million, about 7.7 crore population is in diabetes. And the gradual increase of the prevalence, it will be in 2030, it will be 100.95 million, that is 10 crore. In short, every 10 or 11 person, there is a diabetic person. It is simple, very simple to remember. And about 1 million people per year died due to diabetes and its complications. And an undiagnosed person below the iceberg of the disease, it is pre-diabetic condition. So it is a great burden of the population. Another important in case of diabetes, that diabetes is a disease not only involve one system, it involves multiple systems. So one person, if you understand the diabetes and its complications, you also know different diseases within this side. In case of disease, simply what do we mean by disease? Disease means this is not easy. Not we feel is, it is disease in simple order. But solely it is the lack of comfort, lack of ease or comfort. It is today it is used as a sickness or a problem or departure of the health. Departure from the health means in case of health, we know WHO defined health is a state of complete physical, mental, social, and spiritual well-being, and not merely absence of disease or infirmity, so that a person can live socially and economically productive life. But in case of Ayurveda, they also mentioned health differently. Shamo dosha, shamo agni, shamo samodhatu, malokriya, prasanna atma, indriyo, manaha, shasto, iti vidya. Very nice, defined. In case of diabetes, it is three types. It is metabolic disease, it is a chronic disease, it is endocrine disease, and it is a multi-systemic disease. Involve multi-systems of the disease. Causes due to carbohydrate metabolism impairment, as a lack of, sometimes as a lack of insulin, or either resistance of the insulin. That's two gross problems there. Common features is only hyperglycemia, increased level of blood glucose level, and the complications is according to longevity of the glycogen. Due to long time hyperglycemia, due to lack of secretion of the insulin or defects in insulin action, or in both, it causes long time dysfunctions of the different functions of the organs of the body. It involves eyes, blurring of vision. It involves kidney, nephropathy. It involves nerve neuropathy. It involves stroke in the brain. It also confusion. It also peripheral blood vessels problem. It also involves heart. The different part involved the two according to time parts. The hyperglycemia is nothing but the rise of blood glucose level above the normal level, and the cause of blood glucose level increase carbohydrate intake. We take a carbohydrate and it converts into glucose in the blood. So intake carbohydrate and increase hepatic glucose production. Leverage as the glycogen. So glycogen break down and come in the blood, so increase blood glucose. A decrease peripheral utilization of glucose. If glucose is not utilized by the peripheral tissue, it causes increase of the blood glucose. If decrease insulin that needed for utilization of glucose, then increase blood glucose level. There are four causes to act on intake, on metabolized from the liver, and decrease insulin and decrease peripheral use. These are the four gross causes of increased blood glucose level. Next slide. types of diabetes. Generally, we define two types, type 1 and type 2 diabetes. Insulin dependent, there is no insulin production, so or insufficient growth, insufficient production of insulin, it causes type 1 diabetes. It is about 5 to 10% of the total diabetes in the world. Number 2 diabetes, it is the lifestyle diabetes, where it is non-activation of the proper activation of the insulin. That is insulin resistance. It is adult type of diabetes. It is juvenile type of diabetes, adult type of diabetes, type 2 diabetes. Most common diabetes is adult type diabetes, type 2 diabetes. Most of the people in the elderly age are due to these types of diabetes. Another few types of diabetes is told the pre-diabetic stage. More pre-diabetic stage, if we investigate through the glucose resistance, insulin resistance, then we find the insulin tolerance or glucose tolerance, then we find the pre-diabetic stage of, and treatment needs more in pre-diabetic stage. If you got done in pre-diabetic stage, he or she never attacked diabetes. This is important point, key point of the in case of yogic part. Sometimes we have gestational diabetes. In pregnancy, this is mainly after 20 weeks of pregnancy, they develop diabetes because some steroid hormones are releasing from the placenta and other tissues. So, adrenal tissue. So, it is gestational diabetes. It is also a problem in case of mother. Other specific diabetes, sometimes some genetic involvement. There is a endocrinopathy, some endocrine disease, acromegaly, the Cushing syndrome, thyrotoxicosis, pheocytochroma. These are the adrenal gland defective. Yes. Disease of the pancreas, sometimes pancreatic cancer or pancreatitis, chronic pancreatitis, it may lead to diabetes. Sometimes some drugs may cause diabetes. The drugs are not steroid. They are one they take in the steroid prednisolone. So it may cause diabetes. If you use not judicially, if you use prolonged time, it may cause temporary diabetes or permanent diabetes. Beta blockers and thiazide, you use different drugs, it may cause diabetes. Sometimes viral infections may reduce the immunity and pattern of change of insulin resistance, so they may cause it. The cross type is two types, type 1 and type 2 diabetes, or others sometimes gestational diabetes and pre-diabetic condition. Others are, if we compare the type 1 and type 2 diabetes, type 1 diabetes is young onset, usually less than 35 years ago, before, and after that is type 2 diabetes. Rapid onset of symptoms in case of type 1 diabetes due to ketoacidosis, and gradually development of symptoms in case of type 2 diabetes. So type 2 diabetes is not easily diagnosed by symptoms. When symptoms arises, they already disturb many systems of the body. Usually type 1 diabetes occurs in non-obese person. There is not obese. Juvenile diabetes, young, most younger group, there is no obesity. But in case of type 2 diabetes, there is obesity. In case of type 1 diabetes, body cannot produce sufficient insulin. This is the main cause. In case of type 2 diabetes, body produces insulin, but due to abnormality of the body, it develops insulin resistance. Insulin can't be used properly. And in case of type 1 diabetes, managed by, so insulin not produced, so it is managed by giving the insulin directly. And in case of type 2 diabetes, it just needs the lifestyle changes, diet, and that's something. It is the main target of our management. We know the insulin is secreted from the beta cells of the pancreas. We know the pancreas is not only a endocrine glands, it's also some exocrine functions for digestion. Different enzymes secreted through the gut to digestion. And the endocrine functions is through islets of Langerhans that contains two types of cells, alpha cells and beta cells. Beta cells secretes the insulin and alpha cells secrete glucagon. Insulin is essential for utilization of the glucose by the cells. So right side figure, To look the figure, insulin needed for usage of glucose by the cells. There is a receptor and at the all of the cell of. This is a nice figure made with thinking. In case of the progress of disease, the consequence of diabetes in time, duration of time. In the early age, when we see a mother, baby is IUGR, intrauterine growth retardation. Sometimes the growth in the baby within the weeks, usually after 20 weeks, it is usually 1 pound per week. If it is less than that, we think the IUGR, baby is not growth correctly. This baby leads to diabetes in future. In case of insulin resistance gene, today's modern science can detect the gene of insulin resistance gene and obesity gene. If two genes and IUGR in the earlyhood, they leads to insulin resistance and obesity, intrabdominal obesity. This leads to impaired glucose tolerance and finally leads to type 2 diabetes. And if the beta cell defects is there is into insulin dependent diabetes. If the beta cell works well but insulin resistant, there is non-insulin dependent diabetes. So in the figure, you look the last diagram, the age. The later age, there is type 2 diabetes. Early age, there is a insulin gene resistance, obesity genes, and IUD. And in the middle, there is beta cell defect and the insulin dependent diabetes.
You can show by arrow by your cursor arrow. You can show it.
Exactly. This is IUGR, insulin resistance genes, obesity. In insulin resistance in obesity. Then beta cell defects, directly beta cell defects, insulin dependent diabetes, and resistance insulin non-dependent diabetes, type 2 diabetes. And according to age, 0 to 20 years, this is genetic factors, and 40, 60 gradually develop the type 2 diabetes. This is a very nice figure. You can easily visualize the system. The food we taken, the carbohydrate food we taken is absorbed from stomach and the intestine. This goes to the blood, the glucose, absorbed through glucose, carbohydrate. And pancreas to increase, secrete the insulin, go to the blood. If insulin is resistant, they go out and the sugar cannot be used by the body. This right side figure, this is gut, glucose coming here. This is liver, glycogen coming to the blood glucose level and utilize the muscles in the muscles and also in the fat. So in diabetes, in case of yogic management, we try to increase the at the gut level interval, in the liver level interval, the muscular exercise and muscular level intervals, and reduce the fat at the fat level. These 4 levels we use in diabetes to reduce diabetes. In case of yoga, to reduce diabetes. This is a more deep, but the correct scientific process of the sign symptoms of the diabetes. When there is a lack of insulin, 2 things occur. It occurs increased secretions of glucagon. Insulin detect reduce, but glucagon alpha cell secretion increases. Increase the cortisol, growth hormone, catecholamines, adrenaline, non-adrenaline. It causes two results. One result is decreased anabolism and increased catabolism. Catabolism means distraction, and anabolism means energy gain. It is the reduction of energy, catabolism. Decrease anabolism. So when decrease anabolism, there occurs hyperglycemia, increased blood sugar level in the blood. As a result, we feel fatigue. We have starvation. In the midst of plenty, it develops polyphagia, excessive thirst, developed excessive thirst. And in case of glucose in the urine, it is called glycosuria. And when glucose in the urine, they develop infection. That is called vulvitis and vaginitis, etc., etc. A urinary infection. It causes osmotic diuresis. So it is repeated urination. It is called polyuria. Three common symptoms are polydipsia, polyphagia, and polyuria. And three, excessive appetite, excessive thirst, and excessive urination. Three symptoms are due to hyperglycemia. And there are also salt and water depletion, so tachycardia and hypotension there occurs. And lactic acidosis. In case of increased catabolism, there is glycogenolysis. Genolysis increase. Glycogen from the liver come down. Gluconeogenesis. They are protein used for energy, so wasting of the muscles. Lipolysis. Fat also reduce. Hypercatanemia, increase ketone bodies in the blood. So acidosis and diabetic ketosis is a very, very life-threatening condition. It may lead to death. This is the catastrophe. It is just a diagram for scientific. How diabetes kill a patient gradually. From the above slide, we can easily realize the signs symptoms of diabetes. If we look from head to downwards, if we saw here two things: polydipsia, excessive thirst; polyphagia, excessive food appetite; then lethargy, and also develop a stone. In case of eyes, there is blurred vision. In case of breath, there is a smell of acetone smell. In case systemic weight loss gradually. Respiratory, there is hyperventilation. Gastric level, stomach level, there is nausea, vomiting, and abdominal pain. And ketoacidosis develop, there develop abdominal pain. It's a life-threatening condition. In case of kidney, there is a polyuria and glycosuria. And this side, this is the graphic figure, extreme thirst, that is hunger, nausea, drowsiness, dry skin, frequent urination, and blood vision. These are the symptoms and signs of diabetes. Short. If prolonged time diabetes, there is also complications. The complications developed as the previous slide is mentioned. Metabolic complication, there is a blood glucose level rises and the signs symptoms also. And chronic complications like microvascular complications, that is nephropathy, retinopathy, eye problem, and neuropathy. And macrovascular complications, cerebrovascular accident, cardiovascular accident, and peripheral vascular accident. Look at the right side figure, there is a food, diabetic food. Sometimes patient can only diagnose after a food, ulcer in the food. Non-healing ulcer in the food. It is a most crippling condition. Yeah. And that the right side figure is the gross management of that food. How to diagnose diabetes? After signs symptoms, we look the signs symptoms before slide, previous slide. Then we measure blood scientifically. Normal blood glucose level 70 to 120 milligram per deciliter by ml or DL. Then actually this is the more significant indicator of hemoglobin A1C, glycosylated hemoglobin. Hemoglobin A1C, it is more than 5.7%, it is significant diabetes. Random blood sugar more than 200 milligram per deciliter with clinical signs symptoms. Fasting blood sugar on 26 milligram per deciliter with signs symptoms. Or postprandial blood sugar or oral glucose tolerance test more than 200 milligram 2 hours after taking glucose or carbohydrate load. It is also, and finally, recently insulin resistance test. It is recently done because insulin resistance is more important in case of diabetes diagnosis. So why we need yogic management? because modern science advanced, but there advancing modern science, why we need yogic management in case of diabetes especially. Because diabetes is a lifelong disease. If it is diagnosed on time, it progresses to lifelong and takes maintenance of the lifestyle for a long time. People take medicine and most of the time, but do not get proper information. They do not get information about the disease for long times. Even they are unaware about the efficacy and potentiality of the yoga in the management of diabetes. Most of the people, especially in the Western country, they do not aware the management, the nice management potentiality of yoga in case of diabetes. When diabetes remains undiagnosed and hidden for months or years, the person continue to wrong lifestyle because he doesn't know or because he could not understand the sign symptoms earlier. So their wrong lifestyle continue to perform. When the pathogenesis and the sign symptom arises, it is very difficult to reversal of the diabetes. So early diagnosis and early reversal is the key of yogic management of diabetes. Yogic healthy lifestyle and diet, which is the key. Only two key, yogic healthy lifestyle and the diet is very helpful corrective role in case of diabetes, which is especially in type 2 diabetes, which is not possible only medicine. Conventional medicine. For proper benefit, one needs to understand the yogic way of lifestyle, ahara, vihara, achara, vichara, vyavahara, and diet, and relaxation, etc., etc. Skillfully, dirghokal, skillfully. Imperfect skill may not help, but perfect skillness about yogic practice is essential. This is a nice chart made for algorithm, a step-by-step procedure to solve the problem. At the lower level, yoga practice, at the lower level, key point is increase insulin secretion and decrease insulin resistance. Two key points. This insulin secretion increase and decrease resistance. It is the key point. Also, improvement of the cardiac autonomic function. That is cardiac functions, autoregulatory system, that is cardiac nodal system increases. Sympathomimetic hypothalamo pituitary adrenal axis improvement. And as a result, sir, again talk it about the melatonin, endorphin, that is happy hormone release. That is very important. And also decrease the growth hormone, prolactin, corticosteroid, and adrenaline. It is unhappy hormone. Unhappy hormone decrease, happy hormone increase. This is the idea of physical level. Increase the immunity level. And changes in the cellular level of immunity, that is intercellular fluid exchange through lymphatic drainage. And upper level, reduce body weight, reduce heart rate, respiratory rate. This is very important. In case of psychological changes, we need to diminish the stress or increase the mood and quality of life. In behavioral change level, physically, we can change the diet and the behavior of the person, healthy behavior for the diabetic person. This is the algorithm.
The algorithm means disciplined or nema, the discipline or the some rules and regulation.
Exactly. Algorithm means a step-by-step procedure to achieve the goal.
Yes.
Step-by-step procedure to achieve the goal. In scientific way, it is called algorithm.
Yes. That is in yogic language, discipline.
Exactly,
Okay.
sir.
Yeah.
Discipline. That's right. So in management of diabetes, we use only very simply 3D method. 3D method means diet, that is ahara, discipline, behavioral lifestyle, and the drugs, Oshudhi. 3D method. Even in conventional medicine, they also use the 3D principle. Sometimes they do not. If fast D is ahara is sufficient, first try to ahara, then maintain the discipline, ahara and discipline. If the ahara and discipline fail, they will try to do some medicines. Medicine may be taken. And another principle is important. Yukta Shikha. Yukta Shikha, Veda and Desha. Yukta Shikha means the yogic procedure you must done correctly. If do wrongly, it will not beneficial. Do correctly. Yukta Shikha, Veda. It may vary from person to person. If 4 person coming with diabetes, one person need one type of asana, another person need another type of asana, because their body configuration is not same. Their complication is not same. Their age are not same. So their diet, their asana, their sukshma vyama, their kriyas, their meditation, everything will be changed according to their body needs. And desha means different state, but different region, as there are different types of food pattern, different types of lifestyle. So you must look at that point. So 3D and another yogic three principles, included principle. The diet defines and severity of the disease, body weight, activity, and metabolic needs of the patient to maintain. He maintain to proper calories, protein, carbohydrate, and fats. We usually rearrange the plate. We arrange the plate with more vegetables and less rice or bread, or other flour, etc., etc. Soy protein is very important. Lean protein, avoid skins. Skin of anything is very bad. Carbohydrate, mainly brown rice, whole grains, beans, leafy greens, broccoli, cauliflowers, and fruits. Fibers also important. We use fat mainly, replace the unsaturated fat is important. But saturated fat is very dangerous, or trans fat, that is processed fat, is very dangerous. Use fibers is very important in case of diet. You need 14 gram fibers per 1,000 kilograms. Water is also important part, and vitamins and minerals. In case of diet is very important. So we choose healthy, three important areas. It is healthy food, healthy amount, and healthy time in mind. Healthy food, amount must be healthy, and time should be healthy time, proper timing. Choose low glycemic index food. As Balakar sir mentioned, the low glycemic index food is essential in case of diabetes. The low glycemic index food is low at 0 to 55% carbohydrate. The right side figure, you show the 0 to 5% carbohydrate, low glycemic food items. Apple, 39 glycemic agent and 39%. Wheat cereal, 31%. Soybean, 18%. Cashew, I don't know, okay, exactly. Grapes, that is cherry, Vishkara cherry, different cherries, 46%. Honey, 55% is beneficial. Brown rice, 55%. So these are the low glycemic, middle side, medium glycemic, or right side. You can choose a low glycemic carbohydrate. And sometimes you choose the ketogenic diet. It is a very important in case of modern science. They use ketogenic diet. That is more fat, medium, moderate protein, and low carbohydrate. It is called a standard ketogenic diet. So carbohydrate very less. It helps to lower your blood sugar level. Avoid some saturated food, avoid trans food, avoid cholesterol-rich food, avoid sodium, more sodium, root vegetables like potatoes and soft alcoholic drinks, avoid fruits like mangoes and banana is limited. This figure is also general yogic principle for diabetes because of changes of lifestyle, proper relaxation, proper diet and nutrition, proper exercise, that is asana, proper breathing, pranayama, meditation, positive thinking, proper sleeps, and yukta ahara vihara, achara vichara, vyavahara. And right side figure, if we do practice regularly, within a month, blood sugar level decreases. The right side A figure, blood sugar, it is also experience result. Ahara is very important in diet barbar. This is explained. In case of Chakur Sutra, Charak Sutra, it is defined as Ahara is the life of living being. It is the best medicine and the major cause and also major cause of disease. If you don't use properly diet, it may cause also disease. Yuktahara is important. This is appropriate food as Bhagavad Gita described. Yuktahara viharasya, yukto seshta sukarmashu, yukto sapna bodasya, yoga bhavati dukkha. 6.17. And also in Pradipika, mitahara. Susnigdha madhurahara satuttam vivarjita, bhujjate shiva sampradaya mitahara ujjate. This, if we maintain these two principles instead of ahara, it is sufficient for control of diabetes. So in short, we summarize, do and do more. Always try to, in case of diabetes, to keep hydrated, make healthy food, choice habit, eat regular interval, consume low glycemic food, do not skip breakfast, stay physically active, manage your stress, get adequate sleep, avoid alcoholism. Always avoid trans fats, never overeat, not sleep in a daytime, stop eating fried and fatty foods, avoid large quantities of food, rice and potatoes, bananas, avoid extra salt, avoid alcohol. In short, if we integrated these systems, this is a very nice system. Sir shows also it is a nice system of integrated management of yoga therapy for diabetes. If we take a system, it is not correct. But if we think every existence of this dimension, that is Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vigyanmaya Kosha, and Andamaya Kosha. If we treat every layers of the existence, it will be more beneficial. In case of Annamaya Kosha, we use proper diet, discipline, Satkarma, Vyama, and Asana.
We are coming in next.
Exactly. This is the elaboration of that slide also. Recommended practice based on evidence-based diabetes. Cleansing process, cleansing process, Kapalbhati, Bamandhuti, Shankha Prakhalana, and Agnisar Kriya. Sukma Vyam, Sthula Vyam, sun salutation, suitable postures, asana, control breathing, pranayama, meditation, om chanting, Anulom Vilam, and relaxation, chanting mantras, yogic diet, code of conduct, and philosophy and spirituality. Shatkriyas. This is the elaboration of the Shatkriyas Bhamandhuti. It is an experiment. It is also a tested. A practice causes marked reduction of the fat and postprandial blood sugar level. If we do Bamandhati, it causes marked reductions of the fat and postprandial blood sugar level. Now, after taking food, blood sugar reduces due to Bamandhati. It increases glucose uptake and insulin resistance by using Bamandhati. In abdominal pressure by Kapalbhati exhalation, it causes efficiency of the beta cells to release insulin. In case of Kapalbhati. In case of Shankha Prakshalana, the level of blood glucose falls significantly. It is tested. And Agnishar Kriya, the vacuum effect of the action of the masses of the internal organs of the body, increase metabolism and insulin secretion also. Newly also great help for reduction of diabetes. Surya Namaskar, forward bending, backward bending, and the dynamic process. 20 times Surya Namaskar also reduce the fat and increase the blood glucose profile. Asana in case of diabetes, standing asana, seated asana, this prana asanas and supine asanas. These are the asanas later figure available. How yoga asana works in diabetes? In case of diabetes, yoga asana reduce the adipose tissue, fat tissue. Inflammation reduce and insulin sensitivity increases. In case of pancreas, the beta cell mass functions improving, insulin increase, glucagon reduce. In case of circulatory system, decrease blood glucose level, decrease hemoglobin A1C levels, serum triglyceride also reduce and reduce blood pressure. In case of liver, increase insulin synthesis and hepatic glucose. In decreased triglyceride. In case of muscle, increase glucose level and decrease glucose level, and use the glucose in the muscles properly. Now, the asanas. Just figure, look at. In case of sitting pose, very nice asana is Ardha Matsyendriya asana. Very nice asana. Use Matsyendriya, Ardha Matsyendriya asana. That there is Munduka asana, Gomukha asana, Ushta asana, Paschimotthana asana, Vakra asana. These are the main asana. Helps for diabetes. In case of supine asana, there is Supta Matsyendriya asana, Supta Matsyendriya asana, very nice. In case Pavan Mukta asana, very nice because it presses the abdominal organs and also pancreas. And they are also important. Jatara Parivarta asana. That is opposite side. A nice asana. There is Viparit Karni asana, very nice. There is Sarvanga asana, also very nice. These asanas are very nice in case of diabetes. In case of Pravanasana, there is Makarasana, there is Bhujangasana, Salvasana, Padasalvasana, Dhanurasana. All are important asana. That is the presses the abdomen and also presses the pancreas and the abdominal organs, and sometimes endocrine functions. In standing asana, very main important is the Trikona asanas. Very important, the stress. The Trikona asana, there is a Padasthasana, there is a Ardhakati Chakrasana, there is a Maurasana, and there is Tadasana and also Kati Chakrasana. These are the very helpful asanas in case of that. In case of Pranama, the Anulam Bilam, Nadi Sadhana, Suraya Vedana, Vastika, and Brahmari. These are the very essential asanas. Asanas of Pranama. Mudras are very important part. It is very simple but very helpful in case of मेरे एक हाथ तो नहीं देखा तुम्हारी का लिंगासना, Suraya Mudra, that is Prana Mudra, Apana Mudra. These are the very much important. In case of Jnana Mudra, even in case of Jnana Mudra, then meditation on Manipura Chakra, very important. Manipura Chakra important. meditation on Manipura chakra. Manipura chakra control the digestive system and also pancreas. Om chanting for 5 minutes and yogic relaxation. Last drugs. In allopathy, they use two types of drugs, hypoglycemic drugs, either oral or injectable insulin. In Ayurveda, they use shodhanas, that is panchakarmas, pamana, vicharana, bhasti, this another, the 5 panchakarmas, and shamana, is crucial force to cure illness. Herbs such as effective herbs, amlaki, Kerala, methi, Jaman seeds, haridra, neem, triphala, bale, etc. These are the drugs. This is my reference books, are books, therapeutic books, 6 and 7, and it is online. And this is a presentation. This is a journal. This is my reference. Thank you all.
Very
Closing
nice.
with
Very nicely presented. You can close it. Some
okay.
I thought you had made some rectifying the PPTs. You added something. There is no Manomaya Koshaha, Vijnanmaya Koshaha, and Anandamaya Koshaha. Manomaya Kosha is very, very important.
Sir, there is, sir.
Okay,
there is
where?
okay. There, I see. Okay. Okay.
You
Everything there.
missed there.
Sir. This is Manomaya Kosha.
Okay, but here you are only mentioned the Manomaya Kosha name. You have to give some examples. Means music. Some people are liking music. Some people are liking company. Some people are liking some trekking. You have to do that.
Exactly.
You have to give examples in Manomaya Kosha. Some people are liking chit chat also. They are very much liking chit chat. Gappa goshti bolte हैं ना, गपशप मारना, वो that is also one type of Manomaya Kosha releasing the catharsis.
I tried to explain, but you told us change this slide, so I go